Clearmate is a unique non-electrical medical device that provides treatment to those suffering from carbon monoxide poisoning.
Carbon monoxide gets in your blood and holds onto your red blood cells and just accumulates there. Getting rid of it is very hard. You need high oxygen pressures. And to get those high oxygen pressures, you have to put the patient in a chamber called a hyperbaric chamber. Waiting to put them in the hyperbaric chamber is the equivalent of taking a kid at home with a plastic bag over his head, putting him in your car, driving him to the hospital, waiting for 2 hours until the doctor comes and cuts it off.
With Clearmate, we are able to deliver that treatment immediately and delay long wait.
You can literally cut off the plastic bag as soon as the fireman arrives. The subject breathes on it and gets rid of the carbon monoxide from his blood as fast as that hyperbaric chamber. And our box is just a simple mechanical box. It's about the size of a briefcase.
The Clearmate can be used to treat both spontaneous and non-spontaneously breathing patients. It uses both oxygen and carbon dioxide to allow a patient to hyperventilate without losing consciousness.
By increasing the amount of breathing, we take off less carbon monoxide per breath, but we take off much more cumulatively.
It's portable, it's lightweight, and it is entirely pneumatic and does not require external power to be operated.
Clearmate is designed to be robust with all safety features in mind.
It's used extensively in markets in Southeast Asia, where carbon monoxide poisoning is very prevalent. The Clearmate is very easy to use. A person can be trained on how to use the Clearmate effectively very quickly. The Clearmate can be used in any sort of situation, including in ambulances, in emergency rooms, or even in public facilities.
So basically, you need some sort of technique that can be applied immediately as soon as they're rescued. Because before rescue, clearly nothing can be done. At the moment of rescue is where you want to treat them. The moment of rescue, every second is brain. Every second. So the only effective device for carbon monoxide treatment will be something that you can apply right at the time of rescue, or in the ambulance on the way to a hospital, or immediately as you get to the hospital. Most ambulances can get a patient to a hospital or clinic within 5 to 15 minutes, anywhere in North America. So you need something that can be applied immediately. So the Clearmate is something that we developed exactly for this purpose. We wanted it to be portable, we wanted it to be easy to use, and of course the most important thing had to be, and the first thing, had to be highly effective. So we developed a device that the patient breathes. This device provides some gases for the patient to breathe, which are basically oxygen and some carbon dioxide. And what it does is it allows the patient to breathe harder, harder, and harder, and get rid of their carbon monoxide faster and faster and faster, without their carbon dioxide level going down. Because when carbon dioxide level goes down, brain blood flow goes down, and you're no further ahead. Anybody can see that if they just sat there and started to hyperventilate like this, they'll find that after about a half a minute to a minute, they can't tolerate it anymore. And that's because the carbon dioxide level in the blood has gone down, and that is very uncomfortable for people. So what this device does is it allows you to breathe like that, but keeps your carbon dioxide level normal. So you can do that longer. And in about 20 minutes, you can get rid of half of all the carbon monoxide that you have accumulated, or that the patient has accumulated. So every 20 minutes, you can cut that amount of carbon monoxide in half. So if this is started, for example, at the time of rescue by, say, fire responders, by the time they get to the hospital, before they get any treatment, 50% of the carbon monoxide will be gone. If it's a hospital If they want to send the patient to somewhere where there's a hyperbaric chamber and it takes 20 minutes in the ambulance, another 50% will be gone. It'll be pointless treating anybody. They'll be cured before they get to anywhere where there's a